Hey everyone, and welcome to the spring semester tutorials faculty orientation. My name is Deepu Gowda. I'm the course director for Foundations of Clinical Medicine tutorials. The associate course director is David Kessler. We are super thrilled to be working with you this semester. We really want to thank you for joining the teaching team. We are very much part of a whole enterprise at the medical school over the 4 years. And we as a whole team are committed to developing the clinical skills in our students and helping them become humanistic and effective physicians. And you are very much at the heart of that, especially considering the stage that you're engaging with them at. This is the very early in their clinical career, and you're really laying the foundation for what it means to be a physician for them. So let's think about who this class is, the class of 2021. They are very early in their training. These are first-year students, and this is their second semester of medical school. So what have they done so far? They've had, in their first semester, anatomy, molecular mechanisms, which is basic science, and they've also had a course that they started called Foundations Seminars. This is the basics of communication, things like motivational interviewing, how to help patients change their habits, and just thinking about the role of the physician. This semester, what have they done? So they now have started an integrated pathophysiology course called The Body in Health and Disease. And over the course of the entire year, they'll go through various blocks and learn about pathophysiology, pharmacology, as well as anatomy. So they're just finished neuroscience. And when they come back from spring break, the week of March 19th, they will start their cardiovascular block. Then they go on to pulmonary, renal pathophysiology, and hematology, all during the spring semester. Which means that they have not done GI this semester. They will not have done endocrine. They will not have done musculoskeletal. They will not have done infectious disease. So you see how over the course of the year, their knowledge base grows slowly. So it's nice to know what they've done and what they haven't done, because they're probably going to see cases on the wards with you representing illnesses that they might not yet have studied. So keeping that in mind will help you teach them and keep up with what's going on with them. They're also doing a course called Psych Med, basically introducing them to the basics of psychiatric illness. They will have learned how to take a history with psychiatric patients and learn the basics of a write-up. Other thing I wanted to mention to you is this year our physical exam course structure has changed considerably. One of the main changes is that we're rolling out the teaching of the physical exam in a more integrated fashion with the BHD course, or the pathophysiology course. So what I mean by that is they're learning the neuro exam during their neuroscience block in BHD. They're learning their cardiovascular exam during their cardiovascular block in BHD. And they're learning their pulmonary exam during the pulmonary block in BHD. So in that way, we're better aligning the teaching of the physical with what's happening in other parts of their curriculum. They will learn the abdominal exam and musculoskeletal in a way that's not aligned with BHD, unfortunately, because those blocks are not taught until the fall. But we're going to go ahead and teach those physical exam sections in the spring. So that's a change, and when you guys get the syllabus, you'll see how the rest of the curriculum kind of works together. So what have they done so far in our course and tutorials? So as I mentioned, we've had physical exam teaching that's been aligned with the pathophysiology course, or BHD. So what they've learned so far is how to take the vitals, how to appreciate the general observation. They've learned the HEENT exam, and they've also learned the neurological exam. And the way they've done this is for each of these sections, They've watched videos, which we'll also give you access to. They've read our syllabus, which we'll give you access to. We've had large group practice sessions in the educational building. And with the neuro exam, for instance, we actually had the neurology faculty come and lead those sessions, and where they basically learn the maneuvers, learn some pathology, and get to practice on each other. These sessions have been followed by sessions in the simulation center, where they have, after they've learned, for instance, the neuro exam, they've gone to the simulation center where they've performed those neurological exam maneuvers on standardized patients who we have trained to give feedback. So we've actually trained the standardized patients in elements of the physical exam, and we've trained them to give feedback on those maneuvers. So they've done that already for vitals, HENT, and neuro, and as the semester unfolds, that same kind of cycle of educational activities will be repeated for the cardiovascular exam, pulmonary exam, abdominal exam, musculoskeletal exam. They've also had sessions on how to take a history, how to do a write-up, and how to do an oral presentation, a mixture of lecture as well as small group activities. And before they get to the bedside with you all, they will also have watched a video and gone through slides and taken a quiz on infection control so that they can enter the clinical spaces in a safe way. So let's go over the objectives of our course tutorials. Objective number 1, learning how to take a thorough but also hypothesis-directed history, how to do a thorough and also hypothesis-based physical exam, how to do a write-up, how to do an oral case presentation, how to clinically reason, and lastly, how to go about all of these activities and engage with patients, engage with one another, and with you with a highest degree of professionalism. So let's talk about the bedside sessions. There's 5 of them. So each preceptor is linked with 4 students. So you should have already been linked with your students, should have gotten an email introduction. You should have seen their bios and their email addresses. And many of you have already been in communication with your teams. These are the bedside session dates. As you know, the course occurs on Mondays and Thursdays, so you should be signed up for one or the other. And the sessions always occur from 2 to 5 o'clock in the afternoon. And here are the dates for your reference. Resources. If there's any questions regarding logistics, please reach out to Sarita Martinez. She's the manager of the Fundamentals curriculum, and we are currently in the hiring process for a course coordinator. We don't have a course coordinator right now, but Sarita Martinez has graciously offered to provide administrative support for our course in the meantime. So that's the email address there. If there's any questions regarding logistics. Also, this week we're going to be emailing you all a syllabus. It's going to have the course objectives. It's going to have the schedule for the semester and kind of the overall description of the sessions or the syllabus. And there's also a section in there called Tools, which has the Columbia History Form, which kind of goes over the different aspects of the write-up and what type of information needs to populate each of those sections. We also have checklists that you can use to help give students feedback. There's a checklist on the observed history and physical, on the write-up, as well as the oral presentation. And in addition, we have a set of sample write-ups that are taken from the major clinical year, or major clinical year is basically the term that we use at Columbia for the clerkships. These are actually examples that have been provided to us by the internal medicine clerkship director, and they kind of give you a good sense of where you want the students to be shooting for by the time that they finish our course and enter the major clinical year in January. You also have access to our physical exam videos on a site that we've created called Slate. And here is the URL for Slate. And when you get there, if you're off campus, it'll ask you for a username. So you put in Slate, ask you for a password, and that is Learn Exam, all one word. And you'll have access to all of our physical exam videos, the HNT exam, the neurological exam, cardiopulmonary exam, abdominal, and musculoskeletal. These are the same videos that the students will have been watching. So what happens during the bedside sessions? So I said the sessions go from 2 to 5 p.m. So at 2 o'clock, you basically meet up with your group, go over the plan for the day. Many of the faculty actually get there before 2 o'clock. And the purpose of that is going, meeting your patients, making sure that they're still on board with working with you during the afternoon. So many of the faculty might go by the hospital around 1:30, 1:40, meet their patients, remind them that we're going to work with them that afternoon, and then at 2 o'clock, meet up with their teams. And when you do meet up with your teams, there may be business from the previous time that you met. You may choose to go over write-ups at that time. Every week there's a student leader, and the leader may have particular teaching that they want to do with you. So that kind of what happens right at 2 o'clock may vary depending on the week. And then what happens is, after you're done with that, the students will evaluate each patient in pairs. So if you have 4 students, we can call them student A, B, C, and D. You'll take the first pair, student A and B, let's say, and you'll introduce them to the first patient. After that's done, you take student C and D, and you introduce them to the second patient. After that happens, your job as a preceptor is to then divide your time between both pairs of students. And during that time of observing them directly, you will pay attention to how they're taking the history, how they're doing the physical exam. In general, during the history taking, it's probably best to use light touch, not really heavily involved in immediate feedback, letting them take the history and providing feedback later on. For the physical exam, it actually works just fine to often give them feedback right in real time. Right? So you're basically going to be splitting your time between both pairs of students. The students in general should not be at the bedside for much longer than 1 hour. 1 hour is a long time to be doing a history and physical exam with a patient that's hospitalized and is sick, and going much more than that might be too exhausting for the patients. One thing that we are recommending, that we're going to recommend you do, is for the students to take a clinical reasoning time out after the history and before the physical. And I'll describe that to you in a minute, what that looks like, but it helps to develop their clinical reasoning skills. At no later than 4 o'clock, the whole group, all 4 students and you, should choose a place to meet and then talk about both cases. During that wrap-up period, you're going to hear the presentations from both pairs of students. You'll give them feedback on what you observed from the history and physical. Keep it an open conversation. Everybody gets feedback, so everybody learns from each other. And you should also go through the differential for both cases and really get a sense from them what they think is going on. By the time they leave that wrap-up, they should have a good sense of what history and physical either supports or refutes each of the diagnoses that you're considering for the main problem for each patient. When the students are at the bedside, this is kind of a description of how that bedside time might unfold for the students. So if we say student A and B are at the bedside, student A may start by taking the history. While student A takes the history, student B is taking notes. They're keeping track of the history. They're also starting to work through the differential diagnosis. They're aware of what information is obtained, And they may even have the H&P Columbia History form with them, so they have an idea of what history still remains to be elicited. They'll also help with keeping time. After student A feels like they have completed the history, what we encourage the pairs to do is say to the patient, "Hey, Mrs. Johnson, my classmate and I are just going to step outside for 5 minutes to talk about your situation, and we'll come back in and we'll finish up the history and do a quick physical exam. Does that sound okay?" So remind your students to do this. What they're going to do then is step outside. Both of them will powwow, talking about what they know so far, what history has been elicited, what history is still missing, what is their differential for the main problem, and if a patient has been hospitalized for a while, even if the diagnosis is already known, I want you to encourage the students to imagine that they are evaluating the patient at the point of admission. Don't focus on hospital course for our tutorials course. Focus on the symptoms and history that led up to the hospitalization. That's going to be more aligned with what they're actually going to be doing in the MCY. During that clinical reasoning timeout, they're going to think about the differential. What history still has to be obtained to explore the diagnoses they're considering? In addition, they should start thinking about, well, what physical exam maneuvers do we want to prioritize given the differential that we're considering? So they're going to go back in the room. They might do a few more history questions to explore the differential, fleshing out the history, and then student B is going to come up, do the physical exam. They'll do the exam that is appropriate for the patient at that time, based on the differential. And during that time, student A will be taking notes and will help keep time. Just know that because of the structure that we've developed this semester, by the time the students go to the bedside, they have not actually learned the entire physical exam. So for instance, for session 1, they've only learned the vitals, HENT, and the neurological exam. So a lot of the exam may actually be unfamiliar to them. So this is one of the drawbacks of the structure that we have now, but we still feel that aligning the physical exam teaching with the pathophysiology course allows leverage of kind of understanding of anatomy and pathophysiology that makes the curriculum feel integrated and enhances motivation. So that's kind of how the bedside session works for the hour that the students were with the patient. And we want to say is after the next time that they meet with you, these students should switch roles so that student B taking the history and student A is doing the physical. After the bedside evaluation, we also want the students to give the patient a thank you card. So make sure that the students have thank you cards. They have to pick them up from us, and it's their responsibility to bring them to the bedside sessions and to give the cards to the patients so that the patients know that their time and energy is appreciated and they're considered one of our educators. So this again is just a description of the wrap-up and how it works. We just went over this. One other point that's on this slide is that if you have enough time and you think it's appropriate, you might choose to go back to one of the patient rooms, especially if there's a very interesting history or physical exam finding. You might want to share that with the entire group of 4 students. You also may want to get into the electronic health record if you have access. So let's say you hear crackles on an exam, on the lung exam, and you hear an S3, you might take the students to the bedside. In addition, you might say, hey, let's look at the X-ray to see if we see any signs of pulmonary edema, enlarged cardiac silhouette, or even let's look at the echo results to see what the cardiac function looks like. So those are some examples of how, If you have time and you have access to the EHR, you may match what's happening at the bedside with other data that's available in the EHR. The students then, after the sessions, will do a write-up. They will write up the case and they'll email them to you. Please ask the students not to use patient names in their write-up. Initials are just fine. We don't want that information floating around. The students will share notes. As you remember, student B is taking notes on the history while student A takes the history, and vice versa with the physical exam. They can certainly share data, but they should write the write-ups independently. The first week is a little different, as we will describe, but for the remainder of the course, the write-ups should be independent. We want them to really develop these skills independently so that they can function effectively and independently when they get to the major clinical year. Here are the times when those write-ups should be emailed to you. So if you're a Monday faculty member, the write-up should come to you by Friday at 5 o'clock. If you're a Thursday faculty member, those write-ups should be coming to you on Monday by 5 o'clock. And getting the write-ups to you in a timely fashion is really part of the professionalism and expectations of your students. And if they're not meeting that expectation, please do not consider it a situation where you're telling on your students or getting them into trouble. The point is that professionalism is a skill and a habit, just like anything else that we're training them in. So hopefully you would not be shy about giving them feedback regarding how they're listening to the heart. In the same way, do not be shy about giving them feedback about professionalism if they're late with turning their write-ups in. Only with that feedback will they learn how to improve their habits and become the professionals that we want them to become. So bedside 1, as I mentioned, is a little bit different. So let me describe this session. It will start off with patient 1, where you will be actually performing a history and physical that is focused. Does not have to be a super long, crazy, head to toe physical exam. It can be focused, but it can be a history and physical exam while the other students, all 4 students, are observing your clinical skills. We want you to role model a hypothesis-driven, patient-centered history and physical exam. And we've already told them, hey, look, the faculty member, when they're at that stage of their clinical practice, is not going to be doing all of the maneuvers that you do. And they'll be choosing maneuvers based on what they think the patient needs. And so don't feel, stressed or compelled about having to do a, 100 maneuver exam. Do the exam that you would typically do on your patient and describe your approach. And the students may have questions about, how you decided to do one maneuver or another, or how you ask certain questions. But the most important thing is to leverage the powerful teaching method that is role modeling. So you're role modeling patient-centered, respectful communication and clear thinking, hypothesis-driven physical examination. And we want students to really see that. And then you're going to take the students to patient 2. And here with patient 2, everybody shares in the evaluation. Student A will start by doing the history. Student B will check the blood pressure and then do the HENT exam. Student C will do the cranial nerve exam. And student D will do the rest of the neuro exam. We don't want them to do a gait exam or a Romberg. No need to do pain and vibration or the Weber and the Rinna. But for the most part, the rest of the neuro exam is what we want student D to do. So basically, they really share in the evaluation of patient number 2. And what they'll do basically after they do this evaluation is the students will pair up. Student A and B will do a write-up together and email to you. And students C and D will do a write-up and email it to you. This is the only time this year where they do a write-up together. The rest of the time, they will be turning those write-ups in independently. So attendance at every bedside session is required. We want students to honor this as part of their clinical training. We recognize that you all have canceled clinic, moved patients around, made all kinds of arrangements so that you could be here for these bedside sessions. So we do not want to put pressure on you to meet students' scheduling demands. So we ask you not to change any of your session dates without telling us. Especially if a student comes to you and says, hey, I'm going to be on vacation, I have a conference to go to, can you shift, our session date around? Just be in touch with me. The whole team should be in touch with me. The student should initiate that conversation and should basically CC you in that kind of request. But of course, there are sicknesses, there's family emergencies, unfortunately, or sometimes students may be presenting at a national meeting. If those happen, those can qualify as an excused absence. And if that happens, they should email you, they should email me, and they should also email psfundamentals@columbia.edu. That's a centralized email so that we have a sense overall of what's going on with student absences. Now, what if a student's having trouble? It could be academic trouble, they're just not keeping up, they're having a very hard time with developing these clinical skills, or if it's professionalism, not turning in write-ups, turning them in very late, showing up late, not being dressed properly, or if you suspect psychological problems or emotional difficulties. For any of those situations, please reach out to me as soon as possible. Here's my email address. Do not let a situation like this fester. I am your partner in this, and I want to help you figure out what's going on and provide support for the students. So don't go about it on your own, and don't ignore a situation if it's happening. We want to learn about things early, and so we can provide the support that the student needs and help them get back on track. For student evaluation, you will do a mid-semester feedback that's going to be informal. So we'll send out a notice to just say, hey, this week, make sure to meet with your students and just tell them one-on-one how they're doing, what their areas of strengths are, what their opportunities are for development. And at the very end of the semester, you will be expected to fill out a student performance evaluation. It will have a Likert scale and opportunities for narrative feedback. And basically, it's the same domains: history, physical, write-up, oral presentation, and professionalism. Okay, so it's the same domains as our course objectives, and that's feedback that's really going to help them continue to develop. So be honest, be frank, and be specific for that feedback to actually hit home and make a difference. Overall, please stay in touch with us. This is a major transitional year for the students. They're developing a lot of new skills, and they're going to be doing some stuff that's very exciting for them. Putting on their white coats and finally feeling like they're starting to feel like doctors. It's an exciting time, and we want you to share in that excitement with them. And if you have any feedback from us about the students, about the course, anything, please write to us. Keep in touch with us. We want to hear your comments, and we consider you a collaborator in developing this course with us. We've learned so much over the years from our preceptors. Our course would not exist or be possible without your efforts, and you really are the heart of our teaching efforts, and we thank you sincerely for all of your energy. There's my email address and my cell phone number. Look forward to working with you all this semester, so please be in touch, enjoy it, enjoy the students, enjoy the clinical work, and thank you once again for being our partners in this endeavor.